Tonight, Local 2 investigates a mental health care crisis in Houston.
We have discovered a system of care that leaves many without critical long-term treatment.
All while taxpayers are footing enormous medical bills for what critics say is nothing more than a Band-Aid. Local 2 investigative reporter Robert Arnold spent months researching this problem and explains now why many of those suffering from mental illness don't get help until the police are called.
Michael Gable, we are not going away.
SWAT officers surround the home of a mentally ill man who's just thrown a brick through one of his neighbor's windows.
You need to come out, and you need to come out now.
After hours of stalemate negotiations and a motorized ram breaking out windows to get the man's attention, officers lobbed tear gas into the home. Within minutes, Michael Gable surrendered and was taken away in an ambulance. He spent his 54th birthday in the county's neuropsychiatric center.
Had to come to this with the SWAT team. I mean, this is ridiculous.
Gable's sister, Rosemarie Barnes, isn't angry with police. She's angry it took this use of force to finally get her brother help.
He needs it, and we've been trying to do this for a long time.
Volumes of indecipherable manifestos inside Gable's home show years of mental illness. Since 2002, police have been called to Gable's house 17 times for a range of petty crimes. He's been to jail, the neuropsychiatric center, twice to the Harris County Psychiatric Center, and twice to Rusk State Hospital. Each time he's stabilized, then released with no follow-up care, only to drift back into psychosis.
The last social worker who was at the hospital told my brother, that they're surprised that he's letting him go.
I think he's an example of a system that's broken.
Lieutenant Michael Lee heads up HPD's mental health unit, officers specially trained to deal with the mentally ill. Months before SWAT was called, Lee and his officers tried to peacefully lure Gable out of his red and black fortress to serve him with a mental health warrant. The problem? Mental health warrants are civil, not criminal, and the law doesn't give police clear-cut permission to go into someone's house to serve one.
Something that we wish that one way or the other they would say, well, you either can or you can't.
Gable's now at Rusk State Hospital for his third time. What happened to him is a product of a mental health care system suffering from a critical lack of resources and bed space, all of which forces many of those suffering from mental illness to only get treatment when they're arrested.
We have too many people walking the street untreated and violent.
Dr. Lois Moore heads the Harris County Psychiatric Center, which has 250 inpatient beds, but only enough money to operate 188 of those beds. Countywide, it's even worse. This study by the Mental Health Mental Retardation Authority of Harris County shows there are only 825 inpatient psychiatric beds for a county of more than 4 million.
Folks are saying, where do we place these folks? How do we address these folks? Why do they keep coming back?
The problem is they can't access services if they're not in crisis.
Mental Health America of Greater Houston's Betsy Schwartz says Harris County is focused mainly on treating mental illness only when a person goes into crisis.
We as taxpayers should be outraged.
That's because crisis care is the most expensive. MHA estimates it costs taxpayers between $25,000 and $35,000 per person for crisis care every year. That's because a lack of bed space and no long-term follow-up care when they leave the hospital forces those with mental illness to cycle through the system over and over again. In fact, 20% of the patients seen at the county's neuropsychiatric center last year had been there between 2 and 11 times in 1 year.
Basically what you're doing is spending all the resources you have available on the same patients because they keep coming back.
Like in Gable's case, a lack of resources is also forcing the criminal justice system to take on a greater mental health role. HPD's mental health unit transported more than 2,000 people for psychiatric treatment last year. 60 of those were people who had been picked up by police 3 or more times in 1 year. HPD also estimates 46% of its SWAT call-outs last year dealt with someone who is mentally ill.
The officers get frustrated, the department's frustrated, the leadership's frustrated, and I can understand.
Although police try to avoid it, with so few beds, many of those with mental illness picked up for petty crimes have nowhere else to go but the Harris County Jail.
We are criminalizing people with mental illness.
Everything we've just shown you leads to an overarching problem. The largest inpatient mental health care facility in the state is now the Harris County Jail. Our investigation continues tomorrow night at 10. Also, tomorrow at 6:50 a.m., we'll show you how a lack of resources may have also led to 2 deadly confrontations with police. Robert Arnold, KPRC Local 2.
Texas ranks 47th in the nation when it comes to spending on mental health care. A report from Mental Health America of Greater Houston shows more than 92,000 adults in Harris County have a serious mental illness and no insurance. MHA reports only about 18% of them received mental health services. If you have a story for Local 2 Investigates, call the tip line at 713-223-TIPS or email Local 2 Investigates at click2houston.com.